My name is Jeremy Powell. I have been a healthcare IT professional for about 20 years. I actually started off at the bedside in physical therapy, but all of my life's work has been really around tuning the practice of the physician and clinician team at the point of care to the knowledge that's available to them in other data streams that might not readily present themselves in an electronic medical record. So the business of Acclivity is partnered with Wellbox largely to drive throughput and improvement relative to the kinds of contract metrics that are available to physicians today. Those improvements can be around how often are fee-for-service valuable components being leveraged by that practice, annual wellness visits, our fee-for-service, chronic care management's fee-for-service, transitions of care are all fee-for-service. But those live alongside these value-based contracts where gaps in care have to be reduced, medical cost and utilization have to be improved, and the right quality of care has to be delivered. So we've partnered specifically with Wellbox to help our capabilities be better presented to the care extenders that live in the healthcare practice today, either within the Wellbox nursing staff or within the practice themselves as they're supported by Wellbox. And we've helped lead some of the innovation around chronic care management. When we decided ourselves to partner in this space for a technology and services entity, it was obvious to us that Wellbox had sort of built a special and innovative way to deliver that service. They have a platform that leverages open APIs to be able to collect real-time information from the EMR itself. They have an opportunity for us to leverage those same APIs to get clinical claims, financial, administrative data. But most importantly, I think the interesting thing is they've been innovative on their program design. They deliver multimedia mailouts sometimes and other kinds of components to support more than just telephonic calling, which was unique to us because we see in our work how baselines can trend period over period. Our partnership actually proves that they're one of the best chronic care management companies in the space because we measure a baseline and then we start looking at performance items, things like quality and utilization and medical cost, and we can see from Wellbox's CCM that they're actually driving these improvements over time. The things that we notice about them specifically is they start to change how the ER, our emergency room, is used in the network, so they divert patients from that high-cost area. Unmanaged patients with advanced illness that are often showing up and getting care in inappropriate locations are actually managed better with the Wellbox Chronic Care Management Solutions. And then folks that are utilizing a number of prescriptions, a number of ingredients or a number of medications themselves require extra care. And with the Wellbox capabilities in their design around program management, we see those baselines really start to improve over time with the use of that system and service. At Acclivity, we actually are an analytics workflow and machine learning company, largely focused on this incredible space we occupy in healthcare today. Providers have some fee-for-service contract capabilities, and they are now being pushed to support value-based contracts. In that space that we occupy that's quite unique, we have the ability to actually leverage data from clinical sources, claims, administrative and prescription feeds, and really start looking at how can we design care paradigms within the practice to support how providers themselves can receive revenue from those fee-for-service capabilities like chronic care management, transitions of care, annual wellness visits, but also how those particular programs start driving cost and quality and utilization improvement. We also leverage our capabilities to support event notifications so that if a patient presents in an emergency room and is likely an admission target, we can get involved. Or suggest that involvement happens. We can support high-cost patients who are often struggling with compliance around medication therapy, are often seeking the emergency room for their specific primary care needs. And then we can support triggers and other insights that can be pushed through the Wellbox capability directly into the workflow of the nurses at Wellbox and into the practice team who might offer care coordination and case management services. So as a partner to Wellbox, we see period over period improvement where gaps are closed, quality is improved, and reductions occur across all of the medical costs.